Expert on this topic, but what could an expert say about this laser? Could they say it's gimmicky? Could they say that it's not effective? Could they say you're overstating this?
They could say that, but they wouldn't be aware. They wouldn't be knowledgeable. They haven't taken the courses. They don't have the machine. They don't know what the science is behind it. People who talk like that are talking out of a paper bag.
Okay.
You know,
because it works.
Absolutely works. You know, I was surprised when I went and took my courses that half the class were specialists.
Okay.
Now,
meaning what?
Meaning
periodontists?
Meaning that if a periodontist is willing to give up his scalpel, that must mean something.
And I've interviewed, you know, I've talked to periodontists that are using this machine.
Right.
You say PeriLace, that's what you should ask for because it's the only one FDA approved.
That's the only one.
Is that true? Are you paid by PeriLace?
No, no, I'm not. No, I wish I was.
Okay.
No, I'm not paid by them at all. But they are a wonderful company. The people that invented the technique and the process are all very, very good people, and we've had some great seminars. They're very, very knowledgeable. They really, really know what's going on.
Okay, you say that you're changing people's lives with this. Give me some examples.
Well, we've had plenty of people who have been to the office who had the surgery done the other way. And ordinarily, the periodontist or whoever's doing the surgery can only do maybe 1/4 or 1/2 of the mouth at a time. And then that takes 4 or 5 days of recovery time, which is not very comfortable for the patient. And then they have to go back for the other half. Sometimes they don't go back for the other half because it was too uncomfortable for them.
Okay.
And with us, you know, the patient goes to work the next day. They take a couple of Advil, and they're really very comfortable. They're very surprised. They're thrilled. I had a patient in my office just the other day. For 20 years, she had some loose teeth, and no one could do anything for her. She came to the office. We've improved almost everything with her. She's thrilled.
Like what? Like what goes away?
Well, bad breath goes away. The bleeding goes away. The gums look better. The gums have the architecture they're supposed to have. The shape of the gums, the anatomy of the gums is perfect. It's just the way it's supposed to be. After the gums have been lased, they're more resistant to the disease, which was something that we found in the office. And we're just thrilled. I mean, it's almost like magic. The patients are going through, you know, after a while, they get to realize that something is wrong, and they really can't put their finger on it. You know, they may get a little whiff of bad breath, or somebody may tell them they have bad breath. They'll start talking with their hand in front of their mouth because they don't want to offend people. They don't really like the way their gums look, so they kind of look, they don't smile a lot, you know. Which is, you know, you want to walk around and smile. Why wouldn't you want to smile? You know, it's a nice thing to smile. And they might even have some loose teeth. They might even have some pain in their teeth.
So loose teeth is common. It's a common thing.
Loose teeth is a common thing, but you know, the best thing is to get to the dentist ASAP, have it treated early.
Yeah, where are they headed if they do nothing? Because I guess there's a lot of people that don't like going to the dentist, right?
If they're going to do nothing, you know, they're going to lose their teeth. And psychologically, it's a burden. It's a big burden to lose your teeth. I've had grown men cry in my office.
Is that right?
Yes, absolutely. And people do not enjoy losing a part of their body.
Okay.
So it's really best in the early stages. It sometimes can be reversed. Totally.
People afraid of going to the dentist?
Well, they are afraid of going to the dentist. But again, you know, in my office, we have some oral sedation techniques which are absolutely wonderful. We have patients call us the next day and just can't wait to come back to the office, believe it or not.
Something you said to me, in the old days, the way, which wasn't so long ago, the way you treated periodontal disease in the old days, which is how they're doing it today, for the most part, I guess 95% of the time, you said you didn't even want to call them the next day.
No, I didn't want to call them the next day.
Why?
Well, most of the patients were pretty kind to me, you know, and I'd ask them how they were doing, and they'd say, well, I'm okay, you know.
Because it was painful.
Very painful. You know, when you scrape bone and you reshape bone and you cut the gum tissue away and you wind up with longer teeth and that kind of thing, it's really not a lot of fun.
You say patients would reject treatment?
Well, they would, sure. You know, if I explain to you where we're going to make a slice in your gum here, make a slice there, and then separate your gum from the bone, and then go in and scrape it.
It's not worth it. It's almost worth living with all the symptoms.
It's almost worth living. Well, that's what some people figure. It's worth living with the symptoms. And you know, if I lose my teeth, well, so what? I don't have to go through all of this.
Okay, so what's the answer then?
Well, the answer, of course, is to find someone like myself who's using the PeriLace system, the technique, and make an appointment there and go for it.
How easy is it? I mean, somebody has advanced periodontal disease. They've been told they have to do this other procedure, the surgery.
Right.
They go to you. How long does it take? And describe the downtime.
You know, within an hour, you know, they'll come to the office and we can take films. We take measurements, which gives us a very, very good idea as to where the seal of the gum tissue is this little O-ring seal around the neck of each tooth. And when we measure down from the top of the gum to that seal, will tell us if it's normal or not immediately. You could do it.
So any dentist can do this?
Any dentist.
Okay.
Every dentist is supposed to do that.
So get checked, okay.
Right, get checked. That's how you determine if the disease is beginning. And if it's beginning, if you have 1 or 2 pockets here or there, in other words, if it's more than 3 millimeters, then you should be telling the patient immediately, what to be doing. Floss more, brush more, get a deeper cleaning, do whatever has to be done in the beginning. So as the disease progresses, the treatment gets to be more aggressive. However, with the laser, it's really not an aggressive...
I mean, you just zap it and it kills?
You zap it and it kills it, It actually vaporizes. And the interesting thing is that the laser can determine automatically what's bad and what's good, because the bad bacteria are dark in color, the toxins are dark in color, the infected tissue are dark in color. Anything that's dark in color is going to absorb the energy of the laser.
Like a facial laser in some cases.
That's exactly
interesting.
Right. That's exactly right.
So it hits the bad...
Hit the bad stuff and leaves the good stuff automatically.
What about under the tooth?
Under the tooth, around the tooth, everywhere. It's just when it's a pulsed laser, in other words, it goes on and off, and it just cleans it up beautifully. It's the difference between industrial cleaning and cleaning at home. And
so after the procedure, what do you give them? You give them like a Motrin or something?
Well, you could have some Motrin, you could have some ibuprofen. It's not.
They don't complain about pain?
They don't complain about pain. Of course, you know something was done, but it's really on a scale of 10, it's maybe a 1.
That's what they tell you.
That's right. And if you do it the other way, the old way, you're up at near 9 or 10. So it's pretty uncomfortable.
So people just don't know, because every day they're doing it the other way.
Every day they're doing
just
it the other way.
Just because the dentist they went to doesn't have this laser.
Well, look,
I'm not trying to side with you, by the way, but
no,
if what you're saying is true, it seems that everybody would do it. Look for this laser.
Well, it's something new. You have to get this across to people, for even the average person to come across. No one likes to change their MO.
Okay,
and,
good point.
No one does, and I don't blame them. But when you see something that's good and that it works, we have our patients tell other patients. We've had other patients referred to the office for it, and everyone that we've treated has been very, very happy with the procedure.
And they, when you call them the next day, what do they say?
They say, I know something was done, but I'm at work and I'm doing my work and I'm comfortable. I took a couple of Advil today and I'm fine. Basically, that's it.
Okay, great.
And not the other way, where someone's kind of moaning on the phone and they can just about talk because their face is swollen and.
So this isn't a scare tactic. I've never met anybody that had this procedure, but it's that bad though.
Scare people, no, scare tactics only work momentarily. They don't really work.
Okay.
I've tried that many times. It doesn't work.
All right.
And I got away from it years ago. But I think just giving people information is what's important.
So it's that much better.
All this makes sense. Yeah, it all makes sense. It's all very, very
So now
obvious.
you can do something about it. You don't have to have the bad breath, the swollen gums,
Absolutely.
bleeding. It's hard to believe, though, that flossing, that a little bit of bleeding isn't normal.
It's not normal at all, no. Tissues are too tough. They're supposed to be tough because they take a lot of abuse from chewing and all that French bread that we eat, And,
all right.
And so that kind of irritates the tissues. You want those tissues to be nice and tight and tough. So that they maintain themselves and they stay in place and they support your teeth and you keep smiling and prevent bad breath.
So if you catch it early, is it less expensive as well? I mean,
absolutely more or less expensive. Absolutely less expensive.
I mean, somebody that's just at the early stages of bleeding gums, things like that, they go to see you.
Absolutely.
In and out.
Yes. Yep.
Happy. We're going to take a quick break. We come back, more about the process and what some